Okay, all right. Hello, everyone. Welcome to the CPR seminar series. So today is our great pleasure to welcome Dr. Wensong Shen from the Chinese University of Hong Kong. So before we start, let me briefly introduce our speaker today. Wensong Shen is assistant professor in the Department of Sociology at the Chinese University of Hong Kong. His primary research interests include education, health, child development in China. His work has been published in social science research, research in social stratification, mobility, and other leading journals. He currently serves as a council member of Hong Kong Sociological Association and editorial member of Chinese Education Society and Social Science Research. Dr. Shen today is going to give us interesting presentation on education inequality in China. Yeah, and please. Yeah.
Okay, thank Professor Wang very much for this very kind introduction. And also, I want to thank Professor Mu Zheng for inviting me. So today, it's my great pleasure to share with you my recent study about gender education and health in the context of rural China. So first, I wanted to talk a little bit about why I want to study this topic. So I will begin with some personal observations. So I think many of you may know this famous social media platform in China, the Red Note, 小红书. So I can see some stories there about the rural first generation college students. For instance, this is a note about why do most rural college students end up struggling in life? And this is rural first generation undergrad and grad students are among the most miserable groups. And here, rural college and graduate students, please share the painful experience and stories you have nowhere else to tell. So you can see that these personal stories, they have a lot of comments and likes, which means that they are not just limited to one or two students, but pretty common. And that reminds me actually a very famous article I read when I was in high school. And that was a long time ago, more than 20 years ago. So the title was, I worked hard for 18 years just to be able to sit here and have coffee with you. So basically, the article discussed a story of the first generation rural college students that students moved from an impoverished rural area to the large cities in China to receive college education. And the 18 years here means the time from the newborn to the age when most of the Chinese students attend college. But after that, there was another famous article posted that was, I worked hard for 18 years, not to sit here and have coffee with you. So what does that mean? So it said that, okay, now I have moved from rural areas to the uh, urban area for college education. However, that is not the ending of my story, but it's just the beginning of a long and difficult journey because after receiving college education, I have a lot of realistic difficulties like to stay in the city, I may pay high rent or mortgage. I also needed to send money back to my families, and my families can provide little or no financial support to me. And I needed to work for long hours in demanding jobs, and I'm particularly vulnerable to economic risks. So you can see that all of these real difficulties could cause a lot of mental distress, which means that actually these first generation college students and graduates do not have the leisure and the time and do not have the mood to peacefully have coffee with you. You here means the continued generation students or other socioeconomically advantaged students. So these are some personal experience or observations, and all of them point to a central but often overlooked question regarding the non-material value of college education. So when we talk about college education and its value nowadays, we frequently discuss the monetary returns. And also, we know college education could be good for our health. But when we focus on the health outcomes of college education for a particular vulnerable group, like the women from rural areas who often face intersecting disadvantages, I think the existing studies do not have a clear answer. So that is why I want to study this topic. So now I wanted to move from some personal observations to a global context to sit this study in a broader context. So I think over the past several decades, our world has witnessed at least three significant social transformations: urbanization, educational expansion, and gender equality. So let's look at them one by one. So here are some statistics from the World Bank. So we can see that over the past few decades, the rural population in the whole world's population steadily decreased, and the share of urban population increased to almost 60% in 2022. That is urbanization. And at the same time, there has been a fast educational expansion, like the tertiary school enrollment in the whole world's population has vastly increased to over 40% just a few years ago. So that is educational expansion. And in terms of educational equality, so we can say that actually females have changed their traditional disadvantaged status. So this is the gender parity index in the tertiary education enrollment. And the number larger than one means a female advantage. So you can see that actually nowadays there have been more female college students than male college students. And this is the gross tertiary education enrollment rates for males and females. You can see that in the whole world, actually, the tertiary education enrollment is much higher for females than for males. So that is a trend of gender equality. So all these three general trends point to one important issue, that is, when more young people pursue higher education and obtain college degree, especially those from traditional disadvantaged groups, such as women from impoverished rural background. And then an important question arises, that is, what benefits, particularly the health benefits, does a college education bring to them? So here I want to clarify that I do not distinguish between college education and a college degree in this study, because I solely focus on those students who have finished the formal college education and obtained the college degree. So here I use these terms exchangeably. So for this question, so actually, I think there are at least three strands of literature in sociology that could help us gain a little bit of understanding. So these are about research on first generation college student, research on education and health, and research on social mobility and health. So here, social mobility is a key term because for those first generation college student or graduates, so they are the first generation, right? So which means compared with their parents, actually they have received more education and achieved mobility. So that line of literature is also relevant. So now I want to discuss these three strands of literature in more detail one by one. So let's first look at the study on first generation college students. So the most popular definition of first generation college students is from the US. This group of people are those students whose parents have not received a bachelor's degree. So in their family, they are the first generation college students. So actually, there have been much research on them. So this is a recent thematic review on the first generation college students and their mental well-being. So it shows that in terms of the tension or conflict between academic or social demanding and these students' cultural norms, then first generation college students would experience more anxiety, depression, and stress than the continuing generation college students. However, if we focus on their mental well-being in general, and then these two groups of students have no significant difference. And similarly, another scoping review of 40 papers on first generation college students in the whole world revealed that um, some studies find that mental health problems were more prevalent among first generation college students. However, roughly equal numbers of studies also find that actually there are no significant differences between these two groups in terms of stress, anxiety, and depression, the mental well-being. So you can see that different studies have quite different or even opposite findings. So despite this rich finding, actually, there could still be some significant limitations in this line of research. So one particular limitation is most existing studies just focus on the American society. So another review on research on first generation college students find that majority, that is over 80%, actually focus on the US society. So this is the illustration of the relative share of social context in this line of research. You can see that also from this table, the top 10 studies social contexts are all from the developed societies, and none of them are in Asia. Okay, so that is most of the studies focus on the developed society, particularly US. So, and another limitation is they mainly focus on the college period, that is when they are still college students. But after they graduate from college, and then we do not concentrate on them. So, but the problem is they are first generation college students and they have certain disadvantages originated from their social background. And these disadvantages do not automatically disappear after their graduation. But for research, once they graduate, we just group them into those students or people who have a college degree and then compare them with other people with different educational levels or degrees. And then we do not think this particular group of people are vulnerable or special. I think that could be a problem. And third, the reference group is always continuing generation college students. But how about their childhood peers? So these peers, they have similar disadvantaged social background and experience, but they do not receive education. And the comparison between these two groups would be important and illustrative of the particular value of college education. So these are some limitations in the line of research on first generation college students. And the last two limitations point to this question: does obtaining a college degree confer health benefits or not? So that is the research focus or research question for this study. So now let's move on to the second line of research related to this topic, that is the broad research on education and health. So in this string of literature, there are two particular theories that are relevant. The first one is the fundamental cause theory. It argues that more education corresponds to better health. That is, in general, more education is good for our health, including mental health. That is because education could be a critical social determinant that could provide us with access to flexible resources and also influence a lot of life outcomes. And that influence could be long-term influences. And the second important theory is the resource substitution theory. It brings the gender perspective to the relationship between health and education and argues that the health benefits of education are particularly larger for females than for males. That is because traditionally females are disadvantaged groups in our society. So they have relatively fewer resources than males. So when they receive education, so education as a particular resource would be more meaningful and valuable for them. So all these theories point to the same conclusion, that is more education is good for our health. Okay. And the third line of research is the studies on social mobility and health. So it mainly examines how social mobility would affect our health. So in this line of research, there are also different or even opposite arguments. The first one is actually the social mobility, particularly upward mobility, have positive effects on our health. So that is because the upward mobility would improve our status and resources. And also we can make downward comparison. That is, we compare with those peers who have similar background but do not achieve social mobility. So our current status is better than them. So we will feel happier and more healthy. In contrast, some studies also show that the upward mobility could have negative effects on our health. So that could be because um, the disruption of our social relationships and the related issues. For instance, the dissociative theory argues that when we achieve upward mobility, actually we break away from our original social relationship, and that could lead to a lot of problem. For instance, we have identity uncertainty. We are not sure who we are. We do not belong to our previous identity, but we do not fit into the new social status well. And also we may face social isolation, and there could also be cultural conflicts. And all those problems could hurt our health. And also we can make the upward comparison, that is compared with those people who have better status. Even if we have achieved upward mobility, our current status is still lower than theirs. So we may feel miserable, and then that could be harmful to our health. And also, the upward mobility process can have some direct health costs. For instance, born in a relatively disadvantaged family, to achieve social mobility, we needed to pay more effort to overcome more challenges. And in this process of upward mobility, we even face a lot of discriminations. And all these challenges and discriminations could have some negative impact on our health. So upward mobility could have negative effects on health. So a recent meta-analysis reveals that individuals who experience upward mobility actually had worse mental health than those with stable high economic status. But actually, when compared with those with stable low SES, those upward mobile people have better health. So that is a recent meta-analysis. But I think the debate over the health benefits or health effect of social mobility is still ongoing. So to summarize these three lines of literature, we can find that these three lines of literature actually offer competing perspectives regarding the relationship between health and education. And the current literature is often fragmented and relatively focuses on the first generation college graduates from rural background, particularly women, who often experience greater challenges and emotional strains in the process of mobility. And also there is little attention to societies other than the US. So to address these limitations, I conducted this study. So in this study, I mainly asked two research questions. The first one is, are there health benefits associated with being a first generation college graduate compared with peers who did not have a college degree? And second, if such health benefits exist, do they differ by gender? So now I want to talk a little bit about the data. So I will use China as a case study. That is because China was once the world's largest population and is the world's largest education system. So population and education both are relevant to the key research questions in this study. And also, China experienced the triple social transformations we just discussed at the beginning. That is faster urbanization, educational expansion, and the trend of educational equality. So here are again some statistics from the World Bank focusing on China. You can see that over the past few decades, China experienced the faster urbanization. The current urban population percentage in China's population is over 60%. And also education expansion is also very salient in China. So in 2020, that was 5 years ago, the gross tertiary enrollment rate in China reached over 60%. Okay. And then when we look at the gender difference in education, actually, China has a higher level of gender equality compared with the average level in the whole world. So the gender parity index in the tertiary education enrollment is larger than 1. And also the tertiary education enrollment in females is much larger than that rate in females. So again, a significant trend of gender equality, particularly in education. So again, you can see that the three major social transformations observed in the whole world actually also take place in China and also very salient in China. So in this regard, China provides a very good case to study the question about the first generation college graduates from a rural background. Okay. So in the Chinese context, the existing research shows that the proportion of first generation college students among all undergrad students in China is actually very large. So it was almost 60%. So that means most current undergraduate students in China actually come from a rural background. However, compared with that large number, there has been very limited academic attention to this group of students. That is, when we look at the published research, actually very few about these rural background first generation college students. So that means this study would be very relevant to fill this research gap. In terms of the concrete data set I use for this study, I will use the Gansu Survey of Children and Families. So this is a longitudinal study of 2,000 children in rural northwestern China. And it was conducted in the year 2000, 2004, 9, and 2015. So in the last wave, a total of over 1,600 adults were successfully followed up. And at that time, all of these respondents had finished their formal education. So among these adults followed up in the last wave, 6 had at least one parent with a college degree. So no matter whether they receive college degree or not, they would not be first generation college students. And then the majority, that is 1,607 students, they had parents without any college degrees. So for these students, once they receive a college degree, then definitely they would become first generation college students. And this group of people, that is 1,607 respondents, would form the analytical sample for this study. So actually, because of the special context of this data set, the characteristic of this data set would simplify our research. That is, all these students, all these respondents, their parents had no college degree. So when they finish their college education and receive the college degree, they would automatically become the first generation college students. And then for the outcome variables, that is uh, Oh, the key variables is they call it education experience. So it was measured by the highest level of education they had attained in the last wave. So as I just mentioned, here college education would be equivalent to college degree. I would not distinguish them in this study because I only focus on those who finished the college education. And for their health outcomes in the last wave, I have two measures. The first one is their subjective health measured by 1 to 5, ranging from very bad to very good health status. And the second measure is their depression levels. It is the standard CSD scale. So that was the main outcomes in the last wave, over in their early adulthood after they finished the formal education. And I also used some auxiliary variables in the previous wave in 2009. That was also their subjective health and depression. That is the previous measure of the outcome variables for this study. So these variables are not for analysis, but for handling missed data to improve the procedure of handling missing data. And then to control for the confounding factors, I include a lot of control variables in the first two waves. That was in 2000 and 2004, in their childhood and adolescence periods. So these key confounding variables, including their childhood adolescence subjective health and their internal and externalizing problem, basically their health status, and also their educational achievement in school and their demographics. Also, I include their family socioeconomic status and family characteristics like the family structures, number of siblings, and left behind status, and their parental marital status, and also parental warmth. So here, parental warmth is a standard scale denoting the parental care and support, which would be important for both children's health and educational outcomes. So these are the main variables I used for analysis. So after the main analysis, I also used some additional variables for additional analysis. These variables are the characteristics in their adulthood after formal education. They are their work status, that is, whether they engage in farm work or non-farm work, and their hukou status, whether they change their hukou to a non-rural hukou or remain in a rural hukou status, and also their marital status, married or not, and their parenting status, whether they had children or became a parent or not. Okay, and then for the methods, I mainly use the structural equilibrium models for the analysis. That is because because of the two advantages of SEM. The first one is the full information maximally likelihood. This is a very convenient method for handling missed data. That is because in this 15-year longitudinal data set, the missing data would be a problem. So SEM is good in this regard. And also the multi-group analysis in SEM is very convenient for the comparison between males and females. And then to do a robustness check, I used the propensity score analysis, basically the inverse probability of treatment weighting, combine that with the ordered legit and linear regression. That is because the main analysis method, SEM, rely on the assumption that our regression models have been correctly specified. But if the model specification is mistaken, then the result would be biased. And then the propensity score would be better in that regard. So now let's look at the results. So before we go to the details of analysis, I want to talk a little bit about the data distribution. So let's look at the distribution of quality degrees among males and females. So from this table, you can see that actually the percentage of college degree holders are roughly equal among females and males. So there is no significant difference in this regard. So again, this confirms to the general trend we just observed. That is, there has been a significant trend of gender equality in education. Uh, and one issue we may want to address is would the data missingness be a challenge to our analysis? So as we just mentioned, so in this 15-year longitudinal study, so a lot of respondents, nearly 400, they just dropped out of study for different reasons. So then we may wonder whether this missingness would affect the result or not. So unfortunately, in the data analysis, we can never test whether the missingness would be related to their adult education and health because we do not have that information in our data set. But we can use the previous waves of their health and education to test this because health and education and gender, they are relatively stable over time. So from this table, you can see that the gender is not significantly related to missingness in the last wave, and their earlier education and health outcomes were also not significantly related to missingness. So at least from this result, we are relatively confident that okay, the gender, health, and education seems not to be a serious concern for our analysis. Okay, let's look at the main results. For the first question, are there health benefits for college, first generation college graduates or not? So from this table, we can see that compared with the peers who do not receive college education or college degree, those first generation college graduates actually have better subjective health and lower levels of depression. So both results point to one finding, that is, there is a significant health benefits associated with college education. And then for the second question, are there gender differences in these health benefits? So from this table, we can see that when we take gender into consideration, we can see that the health benefits of receiving college education is significant only among males, but not among females. That is, for these female groups in the rural context, receiving college education, receiving college degree does not significantly improve their health compared with their peers, female peers who do not receive college education. So these are the main results. So to do the robustness check, I use the inverse probability treatment weighting based on propensity score to do further analysis. And I use interaction to test the gender differences. So this is the data balancing. You can see that before we balance the data, actually a lot of factors, including their ethnic minority status, their behavioral problem, mental health, educational achievements, and also some family factors are significantly related to whether they receive college education or not. But after balancing, all of these factors are non-significant. So for the first question, the health benefits for college education, the results are consistent with our main analysis result. That is, those with college education or college degrees have better subjective health and lower depression levels. And also the health benefits of college education are significant only among males, but not among females. So again, the results are very consistent with our main analysis results. So these are the major findings. So the following question would be, how would these results come out? So why are there such a gender difference in the health benefits of college education? So you may wonder the adult outcomes like their work status, hukou status, marriage and parenting status could be potential reasons for these health benefits and the gender difference in the health benefits, right? So I add these outcomes to models to do further analysis. And these are the results. For the first question, adding these adulthood outcomes to the models do not change the significant health benefits. And then for the second question, adding these adult outcomes to the analysis also does not change the gender difference in the health benefits. So, which means these adulthood outcomes are not the major reasons for these gender differences in the health benefits of college education. And then I did another additional analysis, that is to check whether there are gender differences in these adulthood outcomes. So I conducted this additional analysis because I wanted to, again, test whether these findings, that is the gender difference in the health benefits of college education, could be due to some data quality problem. So in theory, any data set could have some potential problems, right? Because this finding is quite different from the finding in the mainstream literature. So we just wanted to double check whether the data is good or not. So personally, I believe the data set, the Gansu several children and families, is a good data set, but I just wanted to do a double check. So you can see that for this adulthood outcome, non-farm work, non-rural hukou, being married, and being a parent. So you can see that college degrees are related to most of these outcomes. Those who receive college education are more likely to engage in non-farm work and also have a non-rural hukou and have delayed marriage, although there are no significant difference in being a parent. I think that is perhaps because they are still relatively young. They are young adults, so they may not be at the age of have a child. So and also for these benefits of college education, you can see that there is no significant gender difference. So these health benefits are observed in both males and females, and these findings are highly consistent with the mainstream literature. So then we have good evidence that, okay, the data is good because these findings are highly consistent with the literature. But we just found that based on this data set, there is still a gender difference in the health benefits college education. So unfortunately, at this moment, I cannot directly figure out what exact reasons contribute to this significant gender difference. Despite that, I think the current study offers important contributions to the existing literature. So let's quickly conclude this study and my presentation. So rising from impoverished rural origins, the first generation college graduates who achieved educational mobility have significant health benefits. They have better subjective health and lower levels of depression compared with their rural peers who did not attain a college degree. However, these health benefits are only observed among rural males, but not among rural females. So these findings challenge the fundamental cause theory and resource subsistence theory, which suggest that more education leads to better health, especially for women. And the findings from this study is different from the argument of both theories. In this regard, this study calls for more nuanced examination of the relationships between quality education, health, and gender, particularly for rural women in non-Western contexts who have traditionally faced multiple disadvantages yet managed to achieve social mobility. And finally, this study enriches research on the health consequences of social mobility, focusing on especially educational mobility. The question of whether upward mobility has positive or negative effects on our health uh, has been debated for a long time. And this study shows that the presence and absence of health benefits of social mobility could coexist. So the key question would be moving beyond the theoretical arguments or debates on the general mobile groups, but put more emphasis on the heterogeneities in the different groups that achieve social mobility, particularly, again, the rural women from the disadvantaged social background. Okay, so that is my presentation today. Thank you very much. And any comments are particularly welcome.
Okay, well, thank you very much, Winsong, for this interesting presentation. Okay, so any questions from our audience, you can directly ask Winsong. Okay, maybe I can ask first question. Okay, Yanwen, you raise your hand. Please go ahead. Yeah, Yanwen.
Okay. Can you hear me?
Yeah.
Okay. Thank you for this exciting study. I guess I have two questions for Wensong. The first is, I think first generation, this term has very specific meanings in the US versus in China, because as you see in China, almost everyone from rural origin who achieve college education are in fact first gen. So I mean, I wonder what is the use of this term of first generation here in China, because they're all first generation college students, right? Right. And this is my first question. And the second is about the dialogue with mobility theories, because I think what you discussed about the positive effects of upward mobility or negative effects of downward mobility or dissociative theory, I think these theories of mobility found on the fact that they have to separate the effects of education from the effects of net mobility. So they are talking about the net mobility effect. But I think for your study, it is mostly the positive effects of the college education itself. So from that perspective, I think sort of different components are mixed together, and you are doing a lot of very informative results for policies, for their life trajectories, but I don't think this will be a very effective dialogue with mobility theories, and reviewers may catch this point a lot, I think. So these are my two major comments. Thank you.
Okay, thank you, Yaman, for these two great questions. So for the first one, the definition of first generation college students. So I agree with you that most students, particularly those from rural areas in China, they would be the first generation college students. So that is, again, consistent with the risk finding, as mentioned in my study, that is over 70% of undergrad students in China would be considered first generation college students. But I don't think this could be a problem for this study because, again, first generation college students, I think they are a very particular group compared with the continuing generation college students because they are disadvantaged. And their experience and also the outcome of their college education would be important for us to study. And the large group size of these students is not an issue, but actually, again, point out the importance of studying them, right? So there are a lot of them, but compared with that large number, the number of studies is limited. So if you wanted to have a more balanced data, you may, examine the first generation high school students in China. That is also fine, but that is not the topic of today. And then for the second question, that is indeed a potential issue. So here in this study, I do not distinguish between the mobility effect and the destination effect. So I think you are talking about these two, right? So in the in the social mobility literature, so researchers have extensively studied the net mobility effect and then separated from the destination effect. And also there is an origin effect, the three main effect. And in this study, I do not distinguish them. So instead, I just focus on one particular outcome or observation, that is whether it's destination effect or mobility effect. We just observe the fact that is those who receive college education compared with those who do not receive college education, do they have better health or not? Okay, so focusing on this question, I think still we could have different arguments. So, but definitely, I think you are right. So this study cannot distinguish between the mobility and destination effect. And in the writing, I will pay more attention to that and also clarify that.
Thank you, Wensheng. I totally agree with you.
Yeah.
I think it's totally fine to do it this way, but it's just uh, talking with this series, you need to be careful because reviewers will point out that this would
Yeah.
not be the ideal way. But in terms of policy effectiveness and informativeness, your approach is totally fine. I appreciate that. Thank you.
Thank you for your question.
Okay, great. Any other questions? Okay, then maybe I can ask one question is that I found, Winston, that you mentioned in the conclusion that your result challenged fundamental cause theory. But I think is education also a fundamental cause? I think you proved fundamental cause theory.
Yeah.
Yeah.
Well, so maybe uh so maybe challenge is a little heavy. So I hope the reviewer do not dislike that word. Okay, so when I say it challenges the fundamental cause theory, I mean the findings. So that is because according to the fundamental cause theory, so education is regarded as a fundamental cause, and it has long-term and consistent positive effect on our health. So
Yeah.
that is the major argument.
Yeah.
However, in this study, we can see that for the females, although they receive more education, but they do not have significantly better health. So then this finding is different from the argument of fundamental cause theory. So we do not disagree in whether health is a fundamental cause or not. We just have different findings regarding the relationship between health and education. So that is what I try to
Yeah.
explain.
But I feel, on the other hand, I think gender is also a fundamental cause. If so, then a male, they enjoy the fundamental cause. So basically, two positive fundamental cause reinforce each other.
Well, so for gender, yeah, to some extent, it could be a significant and important factor affecting health. But I think for the fundamental cause theory, my understanding is its application does not need to distinguish between female and males. So the fundamental cause theory, based on my reading and my understanding, it applies to both. And then if we want to discuss the gender difference, and then a more relevant theory would be the resource substitution theory, as I just mentioned. That is, the health benefits would be more significant or larger for females than for males. That is, it does not deny fundamental cause theory, but it propose a gender difference here. That is, health benefits of education would be larger.
I got it.
for
Yeah,
females.
I appreciate for your response. Any other questions? If no, I also have another question. I'm wondering, because I think it seems that you use a very unique a data set, which is not very common. So may I ask, what are the unique advantages of this data set as compared with other? So
Uh,
there are quite a lot of education data set in China. Now, why did you
yeah.
choose to use this data set?
Yeah, thanks for this great question. So I should have mentioned that in my presentation. So of course, there are some. Let me first discuss some limitations of this data set. So it is not nationally represented.
Mm.
So it just focuses on one particular region in China. So that is one particular disadvantage. But um, even if it has this disadvantage, I think it is a good data set for this study. That is because the longitudinal data set in China is very limited nowadays. If we focus on education, and then the data would be even less, particularly about the first generation college student. So of course, we may use some other national representative data set like the general social survey to pull information about people's education. But the problem is, even if we have that information, we do not have their childhood, adolescent background information. And then to identify the potential health benefits associated with college education, we need this earlier experience as controls. And I don't think any large data set in China have such information. So
Mm.
in this regard, I think the current data set would be the only data set that is available now that could give us this information from childhood, adolescence, and adulthood, including both their health and education information. So I think that is the particular strength of this data set, even if it is not nationally representative. So of course, if any of you have some information about potential new data sets that could be useful, so please share with me. Yeah, thank you very
Okay.
much.
Yeah.
Thank you so
Thank you.
much.
Yeah. Okay. Any other questions from our audience? So I think this is a great experience. I think this is a great opportunity, yeah, to ask any questions to Winsong, and yeah, so you don't have to ask any questions related to his presentation. You can ask any questions basically. Okay.
Okay, so if there are no more questions, then we may
Yeah,
just
yeah, I think it's fine.
go to
Yes.
have lunch.
Yeah, sure, yeah. And by the way, can I ask then, what is the sampling method of this data, and who has collected this data? In again.
Okay, so for the sampling method, so basically I think it's a multi-stage probability sampling.
Mm.
Initially there are 2,000 children surveyed in this data set, and they first identify 100 villages. And then among these villages, they further identify the potential children aged at 9 to 12 years old at the first wave. And then for the PI of this study and the data set, my PhD advisor, Professor Emily Hanna from University of Pennsylvania, she designed the study and was the main PI for this study. Yeah.
Okay, yeah, I think that's great. Yeah. So okay, yeah, that's great. If there are no any other questions, so please join me to thank Professor Wen Song again for this very interesting presentation. And yeah, okay, so this is the end of the today's event. Yeah, and please thank Winston again and wish you have a nice weekend.
Okay, thank you all for attending my presentation, and also thank Professor Wang very much for organizing this seminar. So I look forward to seeing you again soon.
Yeah, okay, sure. Okay. See you. Bye bye. Bye
Okay,
bye,
see you.
everyone.
Bye.
Bye bye.